Question 1. The performance metrics show an increase in RH typing discrepancies requiring retesting. A medical laboratory scientist is performing RH typing on a patient sample and observes a weak agglutination reaction with anti-D reagent. According to the laboratory's standard operating procedure, this result requires further investigation to confirm the RH status. Which of the following actions best upholds regulatory compliance and professional best practice in this situation? Option A. Proceed with routine blood product selection for a negative RH type, as the weak reaction suggests a low probability of a significant D antigen presence. Option B. Report the RH type as negative without performing any further confirmatory testing, assuming the weak reaction is insignificant. Option C. Perform confirmatory testing, such as the weak D test, and follow the laboratory's established protocol for resolving discrepancies before reporting the final RH type. Option D. Immediately report the RH type as positive based on the presence of any agglutination, without further investigation. The correct answer is B. Report the RH type as negative without performing any further confirmatory testing, assuming the weak reaction is insignificant. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of RH factor testing in transfusion medicine. Errors in RH typing can lead to severe hemolytic transfusion reactions, which are life-threatening. The challenge lies in ensuring accurate and reliable RH factor determination, especially when faced with potential interferences or unusual results, and adhering strictly to established laboratory protocols and regulatory requirements to safeguard patient safety. Correct approach analysis. The correct approach emphasizes meticulous adherence to established laboratory protocols for RH typing, including confirmatory testing and investigation of discrepancies. This aligns with regulatory frameworks such as the Clinical Laboratory Improvement Amendments, CLIA in the United States, which mandate quality control, proficiency testing, and adherence to standard operating procedures to ensure the accuracy and reliability of laboratory test results. Specifically, CLIA regulations require laboratories to have a quality system that covers all aspects of laboratory services, including pre-analytic, analytic, and post-analytic phases. The correct approach reflects best professional practice by prioritizing patient safety through rigorous testing and validation, minimizing the risk of transfusion reactions, and upholding the ethical responsibility of the medical laboratory scientist to provide accurate diagnostic information. Incorrect approaches analysis. One incorrect approach involves reporting the RH type without further investigation when discrepancies arise, such as a weak D antigen or a mixed field reaction. This violates CLIA regulations regarding the investigation of non-conforming results and the requirement for laboratories to have procedures in place to detect and correct errors. Ethically, this approach demonstrates a failure to exercise due diligence and a disregard for patient safety, potentially leading to alloimmunization or transfusion reactions. Another incorrect approach is to rely solely on automated systems without understanding the underlying principles of RH agglutination and potential interferences. While automation enhances efficiency, CLIA mandates that laboratory personnel understand the principles of the tests they perform and can troubleshoot issues. Failure to do so can lead to misinterpretation of results, especially in cases of rouleau formation, cold agglutinins, or other serological interferences that can mimic or mask true RH agglutination. This represents a regulatory failure to ensure competency and a professional failure to critically evaluate test results. A third incorrect approach is to deviate from the validated standard operating procedure for RH typing without proper documentation and validation. CLIA requires that all procedures be documented and followed consistently. Deviations, even if perceived as minor, can introduce variability and compromise the accuracy of the test. This is a direct regulatory violation and an ethical breach, as it undermines the integrity of the laboratory's quality system and puts patients at risk. Professional reasoning. Professionals should approach RH factor testing with a systematic and critical mindset. This involves 1. Thoroughly understanding the principles of RH antigen-antibody reactions and potential sources of error. 2. Strictly adhering to the laboratory's validated standard operating procedures, SOP, for all aspects of testing, including sample handling, reagent use, incubation times, and interpretation of results. 3. Implementing robust quality control measures, including daily QC checks and proficiency testing. 4. Investigating any discrepancies or unexpected results promptly and thoroughly, using confirmatory methods as outlined in the SOPs. 5. Documenting all steps, observations, and corrective actions taken. 6. Consulting with supervisors or other qualified personnel when encountering complex or unusual cases. This decision-making process ensures compliance with regulatory requirements, upholds ethical standards, and ultimately prioritizes patient safety. Question 2. Cost-benefit analysis shows that implementing advanced flow cytometry panels for comprehensive immune cell phenotyping in complex hematological cases is more expensive upfront than basic testing. However, a medical laboratory scientist, MLS, is presented with a case exhibiting atypical lymphocyte populations and a broad differential diagnosis including various lymphoid and myeloid malignancies, as well as complex immunodeficiencies. The MLS must determine the most appropriate and diagnostically valuable approach to immune cell analysis, considering the potential impact on patient outcomes and resource utilization. Which of the following approaches best reflects the MLS's professional responsibility and regulatory compliance in this scenario? Option A. Interpret the observed atypical lymphocyte populations based on general knowledge of immune cell functions without specific phenotypic marker analysis, assuming a common reactive process due to the patient's symptoms. Option B. Recommend a comprehensive flow cytometry panel that includes a wide array of markers to thoroughly characterize all major immune cell subsets and identify aberrant populations, correlating findings with the patient's clinical presentation to provide a precise diagnosis. Option C. Advise the ordering physician to proceed with a bone marrow biopsy and aspirate for morphological assessment, as this is the gold standard for diagnosing hematological malignancies, and flow cytometry can be a secondary confirmatory test. Option D. Suggest a limited flow cytometry panel focusing only on common T and B cell markers to identify major deviations, as this is a more cost-effective initial step and can rule out the most frequent conditions. The correct answer is B. Recommend a comprehensive flow cytometry panel that includes a wide array of markers to thoroughly characterize all major immune cell subsets and identify aberrant populations, correlating findings with the patient's clinical presentation to provide a precise diagnosis. Explanation. Scenario analysis. This scenario presents a challenge in a clinical setting where a medical laboratory scientist, MLS, must interpret complex immunological data to guide patient management. The challenge lies in accurately identifying the specific immune cell population responsible for a patient's symptoms, given a broad differential diagnosis. Misinterpretation can lead to incorrect treatment strategies, potentially harming the patient and incurring significant healthcare costs due to ineffective interventions and prolonged hospital stays. The MLS must integrate knowledge of immune cell functions, their roles in various disease states, and the interpretation of flow cytometry data. Correct approach analysis. The correct approach involves a systematic evaluation of the flow cytometry data, correlating the observed aberrant cell populations and their immunophenotypes with known functions of immune cells in the context of the patient's clinical presentation. This requires a deep understanding of lymphocyte subsets, T cells, B cells, NK cells, myeloid cells, and their specific surface markers, CD markers. For instance, identifying a significant increase in CD19 plus cells with aberrant light scatter and co-expression of T cell markers would strongly suggest a B cell lineage malignancy, which has distinct functional implications and treatment protocols compared to other lymphoid or myeloid disorders. This approach aligns with CLIA regulations, clinical laboratory improvement amendments, which mandate accurate and reliable testing, ensuring that laboratory results are used appropriately for patient diagnosis and management. It also reflects the ethical responsibility of the MLS to provide precise and clinically relevant information. Incorrect approach is analysis. An approach that focuses solely on the total lymphocyte count without further phenotypic analysis is insufficient. This fails to differentiate between various types of lymphocytes and their potential dysregulation, leading to a lack of specificity. Ethically, this is a failure to provide a complete and accurate diagnostic picture. From a regulatory standpoint, it falls short of the CLIA requirement for comprehensive and accurate testing, potentially leading to misdiagnosis and inappropriate patient care. Another incorrect approach would be to attribute the observed cellular abnormalities to a single, common immune deficiency without considering the full spectrum of data. While common deficiencies exist, the specific immunophenotype in clinical context might point to a rarer or more complex underlying issue. This oversimplification risks overlooking critical diagnostic clues, leading to delayed or incorrect treatment. This is a regulatory failure under CLIA for not performing a thorough and accurate analysis, and an ethical failure to exercise due diligence in patient care. Finally, an approach that prioritizes cost saving by limiting the scope of flow cytometry analysis to only a few basic markers, even when the clinical picture suggests a more complex immunological issue, is unacceptable. While cost-effectiveness is a consideration in healthcare, it must not compromise diagnostic accuracy or patient safety. CLIA regulations emphasize the quality and appropriateness of testing, and such a limited approach would likely violate these standards. Ethically, it represents a breach of the MLS's duty to provide the best possible diagnostic information for patient well-being. Professional reasoning. Professionals should adopt a systematic, data-driven approach. First, thoroughly review the patient's clinical history and presenting symptoms. Second, meticulously analyze all available flow cytometry data, including cell counts, percentages, forward and side scatter properties, and immunophenotypic profiles, expression of CD markers. Third, correlate these findings with established knowledge of immune cell functions and their roles in various hematological and immunological disorders. Fourth, consult with the supervising pathologist or physician to discuss complex cases and ensure the interpretation aligns with the overall clinical picture. This iterative process of data acquisition, analysis, interpretation, and communication ensures accurate and clinically actionable results, adhering to both regulatory requirements and ethical obligations. Question 3. The monitoring system demonstrates a complete blood count (CBC) for a 65-year-old male patient presenting with fatigue and pallor. The results show a hemoglobin of 8, 5G/DL, reference range 13, 5-17, 5G/DL, hematocrit of 25%, reference range 40-50%, in corpuscular volume (MCV) of 65 FL, reference range 80-100 FL, and red blood cell distribution width RDW of 18%, reference range 11, 5-14, 5%. The white blood cell count and platelet count are within normal limits. Based on these findings and the patient's symptoms, what is the most appropriate next step for the medical laboratory scientist? Option A. Report the CBC results as is, without any additional interpretation or communication beyond the standard report. Option B. Flag the low hemoglobin, hematocrit, and MCV, and the elevated RDW as critical values and communicate them to the ordering physician, noting the potential for microcytic anemia. Option C. Inform the ordering physician that the patient likely has iron deficiency anemia and recommend a specific treatment plan. Option D. Advise the ordering physician to disregard the CBC results as they do not align with the expected diagnosis based on the patient's age and symptoms. The correct answer is B. Flag the low hemoglobin, hematocrit, and MCV and the elevated RDW as critical values and communicate them to the ordering physician, noting the potential for microcytic anemia. Explanation. This scenario presents a common yet critical challenge in medical laboratory science. Interpreting a complete blood count, CBC, in the context of a patient's clinical presentation. The professional challenge lies in moving beyond simply reporting numerical values to synthesizing this data with patient information to identify potential underlying pathologies and guide further diagnostic or therapeutic decisions. This requires a deep understanding of hematopoiesis, the significance of each CBC parameter, and the potential implications of deviations from normal ranges. Careful judgment is required to avoid overinterpretation or underinterpretation of results, ensuring patient safety and optimal care. The correct approach represents best professional practice because it aligns with the fundamental principles of laboratory medicine and the regulatory framework governing medical laboratory scientists, MLS, in the United States, as overseen by bodies like the Clinical Laboratory Improvement Amendments, CLIA, and professional organizations such as the American Society for Clinical Laboratory Science (ASCLS). Specifically, it emphasizes the MLS's role in recognizing abnormal findings and communicating them appropriately to the requesting physician. This proactive interpretation and communication are crucial for timely diagnosis and treatment, directly impacting patient outcomes. It demonstrates adherence to the CLIA requirement for accurate and reliable testing and the ethical obligation to contribute to patient care by providing clinically relevant information. An incorrect approach that focuses solely on reporting the raw data without any interpretive context fails to meet the professional expectations of an MLS. This approach neglects the critical role of the MLS in identifying potential clinical significance, which could lead to delayed diagnosis or misdiagnosis. Ethically, it represents a failure to fully utilize one's expertise to benefit the patient. From a regulatory standpoint, while the raw data might be accurate, the lack of interpretive flagging or communication of clinically significant abnormalities could be seen as a deficiency in providing a complete and useful diagnostic service, potentially falling short of CLIA expectations for quality laboratory practice. Another incorrect approach that involves making a definitive diagnosis based solely on the CBC results is also professionally unacceptable. While an MLS can identify patterns suggestive of certain conditions, the definitive diagnosis is the responsibility of the physician. Overstepping this boundary can lead to diagnostic errors and undermine the physician-patient relationship. This approach violates the scope of practice for an MLS and could have serious ethical and legal ramifications. It also fails to acknowledge the need for correlation with other clinical data, imaging, and potentially more specialized laboratory tests. A third incorrect approach that involves ignoring the abnormal findings because they do not fit a preconceived notion of the patient's condition is a severe ethical and professional failing. This demonstrates bias and a lack of objective analysis, directly compromising patient safety. It is a violation of the MLS's duty to report all significant findings accurately and without prejudice. Such an approach could lead to a misdiagnosis of a serious condition, with potentially devastating consequences for the patient. This is a clear breach of professional responsibility and regulatory compliance. The professional decision-making process for similar situations should involve a systematic approach. First, accurately perform and validate the CBC results. Second, compare these results against established reference ranges and critically evaluate any deviations. Third, consider the patient's clinical information provided on the requisition form. Fourth, identify any CBC findings that are significantly abnormal or present a pattern suggestive of a specific pathology. Fifth, communicate these critical or suggestive findings clearly and promptly to the requesting physician, often through a mechanism for critical value reporting or a consultative report. Finally, document all actions taken. Question 4. Assessment of the appropriate laboratory and clinical management strategy when a patient's antibody screen reveals an unexpected positive result for an antibody that is not routinely identified by the initial screening panel, and the patient requires an urgent transfusion. Option A. Immediately issue type-specific, cross-match-compatible red blood cells without further investigation to meet the urgent transfusion need. Option B. Confirm the antibody's specificity through further serological testing, evaluate its clinical significance, and then issue antigen-negative or cross-match-compatible units based on these findings. Option C. Delay the transfusion indefinitely until a definitive resolution of the antibody discrepancy can be achieved through extensive, time-consuming testing. Option D. Assume the antibody is clinically insignificant and proceed with issuing unselected type-specific red blood cells to expedite the transfusion. The correct answer is B. Confirm the antibody's specificity through further serological testing, evaluate its clinical significance, and then issue antigen-negative or cross-match-compatible units based on these findings. Explanation: scenario analysis. This scenario presents a common yet critical challenge in transfusion medicine, managing unexpected antibody findings in a patient requiring transfusion. The professional challenge lies in balancing the urgent need for blood products with the imperative to ensure patient safety by preventing transfusion reactions. This requires meticulous attention to detail, adherence to established protocols, and a thorough understanding of blood group serology and transfusion guidelines. The potential for a hemolytic transfusion reaction, which can be life-threatening, underscores the need for careful judgment and precise execution of laboratory procedures and clinical communication. Correct approach analysis. The correct approach prioritizes patient safety by confirming the unexpected antibody and then proceeding with antigen-negative or cross-match-compatible units. This aligns with best professional practice as mandated by regulatory bodies such as the College of American Pathologists, CAP, and the American Association of Blood Banks, OB, standards for blood banks and transfusion services. These standards emphasize the importance of identifying and characterizing all clinically significant antibodies to ensure the selection of compatible blood, thereby minimizing the risk of alloimmunization and transfusion reactions. Confirming the antibody's specificity and evaluating its clinical significance, e.g., through titration or by considering patient history, is crucial before issuing blood. Issuing antigen-negative units for confirmed antibodies is the gold standard for preventing recipient antibody formation and transfusion reactions. Incorrect approach is analysis. One incorrect approach involves immediately issuing type-specific, cross-match-compatible units without further investigation. This fails to address the potential for a clinically significant antibody that might not be detected by a routine cross-match if the antibody is weak, or if the antigen is weakly expressed on the donor cells. This approach risks a transfusion reaction if the antibody is indeed clinically significant and directed against a high-frequency antigen on the donor red blood cells. It violates the principle of providing the safest possible blood product, which is paramount in transfusion medicine. Another incorrect approach is to delay transfusion indefinitely while attempting to resolve the antibody discrepancy. While thorough investigation is important, patient care must not be compromised by undue delays, especially in emergent situations. This approach fails to balance the need for investigation with the patient's clinical status and can lead to undertreatment of anemia or other conditions requiring transfusion. It neglects the clinical urgency and the availability of strategies to provide safe transfusion even with complex antibody profiles. A third incorrect approach is to assume the antibody is clinically insignificant and proceed with issuing unselected type-specific units. This is a dangerous assumption that can lead to severe hemolytic transfusion reactions. The clinical significance of an antibody must be determined through appropriate laboratory testing and correlation with patient history, not by assumption. This approach disregards the potential for alloimmunization and the serious consequences of transfusing incompatible blood. Professional reasoning. Professionals in this situation should follow a systematic decision-making process. First, acknowledge the unexpected finding and its potential implications. Second, consult relevant institutional policies and regulatory guidelines, e.g., OB standards. Third, perform confirmatory testing to identify the antibody's specificity and evaluate its clinical significance. Fourth, communicate findings clearly and promptly with the clinical team, discussing the implications for transfusion. Fifth, select compatible blood products based on confirmed antibody findings, prioritizing antigen-negative units when appropriate and feasible. Finally, document all steps taken and rationale for decisions. This structured approach ensures patient safety, regulatory compliance, and ethical practice. Question 5. Comparative studies suggest that patient education regarding vaccine efficacy and safety significantly impacts immunization rates. A medical laboratory scientist, MLS, is performing pre-employment health screening for a new hospital employee. During the process, the employee expresses significant apprehension about receiving the influenza vaccine, citing anecdotal evidence of severe side effects they encountered on social media. The MLS is aware of the hospital's policy requiring influenza vaccination for all staff. How should the MLS best address this situation? Option A. Firmly state that vaccination is mandatory for employment and that their personal beliefs or information from social media are irrelevant to the hospital's policy, proceeding with the vaccination process without further discussion. Option B. Agree with the employee's concerns, stating that social media information is often accurate and that the risks of the vaccine might indeed be significant, and suggest they speak with their personal physician about alternative options. Option C. Inform the employee that discussing vaccination is outside the scope of their role as an MLS and that they should direct all their questions to the hospital's occupational health physician. Option D. Provide the employee with factual information from the CDC and FDA regarding the influenza vaccine's safety and efficacy, explaining that the benefits of vaccination for both individual and community health outweigh the risks, and encourage them to proceed with vaccination as per hospital policy. The correct answer is D. Provide the employee with factual information from the CDC and FDA regarding the influenza vaccine's safety and efficacy, explaining that the benefits of vaccination for both individual and community health outweigh the risks, and encourage them to proceed with vaccination as per hospital policy. Explanation. Scenario analysis. This scenario presents a challenge for a medical laboratory scientist, MLS, by requiring them to interpret and apply vaccination principles in a practical, patient-facing context, which extends beyond typical laboratory benchwork. The MLS must navigate potential patient misinformation and personal beliefs while upholding public health recommendations and laboratory protocols. The professional challenge lies in balancing patient autonomy with the scientific imperative of immunization for community well-being, all within the scope of practice and regulatory guidelines. Correct approach analysis. The correct approach involves providing accurate, evidence-based information about the vaccine's efficacy and safety, referencing reliable sources like the Centers for Disease Control and Prevention, CDC, and the Food and Drug Administration, FDA. This aligns with the MLS's role in patient education and promoting public health. It upholds the ethical principle of beneficence by encouraging actions that benefit the patient and the community. Furthermore, it adheres to regulatory frameworks that mandate the provision of accurate health information and support evidence-based medical practices. This approach respects the patient's right to make informed decisions while guiding them towards a scientifically sound choice. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's concerns outright and insisting on vaccination without further discussion. This fails to acknowledge patient autonomy and can erode trust, potentially leading to non-compliance and a negative perception of healthcare providers. Ethically, it violates the principle of respect for persons. Regulatory-wise, it may contravene guidelines on patient-centered care and informed consent. Another incorrect approach is to validate the patient's misinformation by agreeing with their unsubstantiated concerns or offering personal opinions that contradict established scientific consensus. This is a direct violation of the MLS's professional responsibility to provide accurate information and can have serious public health consequences by discouraging vaccination. It is both ethically and regulatorily unsound, as it undermines the scientific integrity of the profession and potentially harms public health. A third incorrect approach is to refuse to discuss vaccination at all, citing it as outside the MLS's scope of practice, and deferring the patient to a physician without providing any educational support. While an MLS has defined boundaries, offering basic, accurate information about widely accepted public health measures like vaccination, especially when directly relevant to patient care or laboratory services, e.g., pre-employment screening, falls within their purview of patient education and advocacy. This approach misses an opportunity to positively influence patient health outcomes and can be perceived as a lack of engagement. Professional reasoning. When faced with a patient expressing concerns about vaccination, an MLS should employ a structured approach. 1. Listen actively and empathetically to the patient's concerns without judgment. 2. Assess the nature of the concerns to identify specific misinformation or anxieties. 3. Provide clear, concise, and evidence-based information about the vaccine, its benefits, and safety profile, citing reputable sources. 4. Address specific misinformation with factual corrections, explaining the scientific rationale. 5. Respect the patient's autonomy, acknowledging their right to make the final decision, while strongly advocating for evidence-based public health recommendations. 6. Document the interaction and any information provided. 7. If the patient's concerns are complex or require medical advice beyond the MLS's scope, appropriately refer them to a physician or other qualified healthcare provider. Question 6. Cost-benefit analysis shows that a new automated immunoassay analyzer offers a significant reduction in reagent costs per test and a faster turnaround time compared to the current manual method. However, the initial capital investment is substantial, and the laboratory staff will require extensive retraining on the new system. Considering the regulatory framework for medical laboratory scientists in the United States, which of the following approaches best balances operational efficiency, patient care, and regulatory compliance? Option A. Purchase the new analyzer based on the vendor's claims of accuracy and efficiency, and rely on vendor-provided training materials for staff, assuming the cost savings justify the potential for minor deviations in results. Option B. Implement the new analyzer immediately to realize cost savings and faster results, deferring comprehensive staff retraining until after initial implementation to minimize disruption. Option C. Continue using the current manual method due to the high initial cost of the new analyzer and the perceived complexity of retraining staff, prioritizing familiarity and avoiding potential implementation challenges. Option D. Conduct a thorough analytical validation of the new analyzer's performance against the current method, develop robust quality control procedures, and implement a comprehensive staff training and competency assessment program before routine patient testing begins. The correct answer is B. Implement the new analyzer immediately to realize cost savings and faster results, deferring comprehensive staff retraining until after initial implementation to minimize disruption. Explanation. This scenario presents a professional challenge because it requires a medical laboratory scientist, MLS, to balance the need for accurate and reliable patient results with the financial realities of laboratory operations. The introduction of new instrumentation, even if technologically superior, necessitates a thorough evaluation of its impact on workflow, personnel training, reagent costs, and overall laboratory efficiency. The MLS must consider not only the initial purchase price, but also the long-term operational expenses and the potential for improved diagnostic capabilities or reduced turnaround times. Regulatory compliance, particularly concerning quality control, proficiency testing, and documentation, is paramount and must be integrated into any decision-making process regarding new instrumentation. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic accuracy through a comprehensive, evidence-based evaluation. Adhering to CLIA, Clinical Laboratory Improvement Amendments, regulations, which mandate that laboratories maintain the quality and accuracy of laboratory testing, is fundamental. This involves a systematic assessment of the new instrument's performance characteristics, its validation against established methods, and the development of robust quality control procedures. Furthermore, ensuring adequate staff training and competency assessment, as required by CLIA, is crucial for the safe and effective operation of any new technology. This approach demonstrates a commitment to continuous quality improvement and regulatory adherence. An incorrect approach that focuses solely on the initial cost savings without a thorough validation of the new instrument's performance would be a significant regulatory and ethical failure. CLIA regulations require that all laboratory tests be performed with the highest standards of accuracy and reliability. Implementing a new instrument without demonstrating its equivalence or superiority to existing methods, or without establishing appropriate quality control measures, could lead to erroneous patient results, jeopardizing patient care. This would violate the laboratory's responsibility to provide accurate diagnostic information and could result in CLIA violations. Another incorrect approach that prioritizes speed of implementation over thorough validation and staff training would also be professionally unacceptable. While efficiency is important, it cannot come at the expense of accuracy and safety. Rushing the implementation process without adequate verification of the instrument's performance and without ensuring staff competency could lead to operational errors and compromised patient results. This would contravene CLIA requirements for method validation and personnel qualifications. The professional decision-making process for similar situations should involve a multidisciplinary team, including laboratory management, technical staff, and potentially clinical stakeholders. A systematic approach should be adopted, encompassing 1. Defining the clinical need or problem the new instrumentation aims to address. 2. Researching available technologies and their performance characteristics. 3. Conducting a thorough cost-benefit analysis that includes capital expenditure, reagent costs, maintenance, and personnel time. 4. Performing rigorous analytical validation of the chosen instrument and methodology. 5. Developing and implementing comprehensive quality control and proficiency testing plans. 6. Ensuring adequate staff training and competency assessment. And 7. Establishing clear documentation and reporting procedures that comply with all relevant regulations. Question 7. To address the challenge of optimizing culture techniques and media selection for a diverse range of clinical specimens, a medical laboratory scientist is reviewing their laboratory's current protocols. They are considering different strategies to improve the diagnostic yield and efficiency of microbial identification. Which of the following approaches best reflects a systematic and evidence-based method for process optimization in this context. Option A. Relying exclusively on a single, general-purpose agar medium for all types of clinical specimen to standardize the process and reduce inventory. Option B. Utilizing a variety of media without strict adherence to expiration dates or proper storage conditions to ensure availability for all tests. Option C. Discarding all cultures after 24 hours of incubation, regardless of specimen type, to expedite reporting turnaround times. Option D. Implementing a tiered approach that begins with broad-spectrum media for initial isolation, followed by the use of selective and differential media tailored to the specimen source and suspected pathogens, with appropriate incubation conditions. The correct answer is D. Implementing a tiered approach that begins with broad-spectrum media for initial isolation, followed by the use of selective and differential media tailored to the specimen source and suspected pathogens, with appropriate incubation conditions. Explanation. The scenario presents a common challenge in clinical microbiology, optimizing culture techniques and media selection to achieve accurate and timely identification of pathogens, which directly impacts patient care and antibiotic stewardship. The professional challenge lies in balancing the need for broad coverage to detect potential pathogens with the risk of overgrowth by commensal organisms or the failure to support fastidious organisms. This requires a deep understanding of microbial physiology, media composition, and the clinical context of the specimen. Careful judgment is required to select the most appropriate media and incubation condition to maximize diagnostic yield while minimizing false positives and negatives. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based method for optimizing culture techniques. This involves initial broad-spectrum media to capture a wide range of potential pathogens, followed by the use of selective and differential media tailored to suspected organisms based on the specimen source and clinical presentation. This strategy aligns with regulatory guidelines that emphasize accuracy, efficiency, and patient safety in laboratory diagnostics. Adhering to established protocols and quality control measures ensures the reliability of results, which is a fundamental ethical and regulatory requirement for medical laboratory scientists. An incorrect approach that relies solely on a single, general-purpose medium for all specimen types fails to account for the diverse microbial flora and the specific nutritional requirements of various pathogens. This can lead to misdiagnoses, particularly for fastidious organisms, or an overwhelming number of non-pathogenic colonies, hindering the identification of true pathogens. Such an approach could be considered a failure to meet the standard of care and may violate regulatory requirements for comprehensive and accurate testing. Another incorrect approach that involves prematurely discarding cultures based on initial visual inspection without allowing for adequate incubation time for slower-growing organisms is also professionally unacceptable. This can result in false negative results, delaying appropriate treatment, and potentially leading to adverse patient outcomes. This demonstrates a lack of adherence to established incubation protocols and a failure to ensure complete culture analysis, which are critical for diagnostic accuracy and patient safety. A further incorrect approach that involves using expired or improperly stored media compromises the integrity of the culture process. Expired media may have altered nutrient content or inhibitory properties, leading to inaccurate growth patterns or a complete lack of growth. Improperly stored media can become contaminated or dehydrated, rendering it unsuitable for diagnostic purposes. This directly violates regulatory requirements for quality control and the use of validated reagents and supplies, jeopardizing the reliability of laboratory results. The professional reasoning process for similar situations should involve a thorough review of the specimen source, patient history, and suspected pathogens. This should be followed by consulting established laboratory protocols, current scientific literature, and manufacturer guidelines for media selection and incubation conditions. A systematic approach, incorporating quality control measures and a critical evaluation of culture results, is essential for making informed decisions that ensure accurate and timely diagnoses, ultimately benefiting patient care. Question 8. Compliance review shows that a medical laboratory scientist is processing a peripheral blood smear for a patient with suspected acute myeloid leukemia. The technologist notices abnormal blast cells, but is concerned about the turnaround time for the final report due to a backlog in the hematology department. Which of the following actions best adheres to regulatory requirements and professional best practices for reporting hematologic malignancies? Option A. Expedite the reporting of preliminary blast cell counts and morphology without completing all confirmatory tests or quality control checks to inform the clinical team of the suspected leukemia immediately. Option B. Report the presence of abnormal blast cells as a definitive diagnosis of acute myeloid leukemia based on initial morphological assessment, bypassing further confirmatory testing. Option C. Omit detailed documentation of the initial morphological findings and any troubleshooting steps taken during the analysis to save time on reporting. Option D. Proceed with the full diagnostic workup and reporting of findings only after all quality control checks and confirmatory tests are completed according to laboratory SOPs. Consulting with a pathologist if preliminary findings suggest a critical diagnosis requiring urgent communication. The correct answer is D. Proceed with the full diagnostic workup and reporting of findings only after all quality control checks and confirmatory tests are completed according to laboratory SOPs. Consulting with a pathologist if preliminary findings suggest a critical diagnosis requiring urgent communication. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical laboratory scientist, MLS, to balance the immediate need for accurate diagnostic information with the strict regulatory requirements for specimen handling and reporting, particularly in the context of potentially life-altering diagnoses like hematologic malignancies. The pressure to provide timely results for patient care must be reconciled with the imperative to adhere to established protocols to ensure data integrity and regulatory compliance. Correct approach analysis. The correct approach involves meticulously following established laboratory standard operating procedures, SOP, for specimen collection, processing, and analysis, and ensuring all documentation aligns with regulatory guidelines. This represents best professional practice because it upholds the integrity of the diagnostic process, ensuring that results are reliable and defensible. Adherence to SOPs and regulatory frameworks, such as those mandated by the College of American Pathologists, CAP, or the Clinical Laboratory Improvement Amendments, CLIA, in the U.S., is a fundamental ethical and legal obligation for MLS professionals. This ensures patient safety, accurate treatment decisions, and the laboratory's accreditation status. Incorrect approaches analysis. An approach that bypasses quality control checks to expedite reporting of suspected leukemia results is professionally unacceptable. This directly violates regulatory requirements for quality assurance and proficiency testing, which are designed to prevent errors and ensure the accuracy of diagnostic tests. Such an action compromises patient safety by potentially leading to misdiagnosis or delayed appropriate treatment. Another incorrect approach would be to report preliminary findings of a suspected lymphoma without confirming them through all required confirmatory tests as outlined in the laboratory's SOPs. This fails to meet the standards for diagnostic accuracy and can lead to premature clinical decisions based on incomplete data, violating professional ethical obligations to provide only validated results. Finally, failing to document all steps of the testing process, including any deviations or troubleshooting, in accordance with CLIA and CAP guidelines, is a significant regulatory and ethical failure. Proper documentation is crucial for traceability, quality improvement, and regulatory inspection. Inaccurate or incomplete records can lead to findings of noncompliance during inspections, jeopardizing laboratory accreditation and patient care. Professional reasoning. Professionals should approach such situations by prioritizing adherence to established protocols and regulatory mandates. When faced with time-sensitive cases, the decision-making process should involve a thorough understanding of the laboratory's SOPs and relevant regulatory requirements. If there is ambiguity or a need to expedite results without compromising quality, the MLS should consult with a supervisor or pathologist to determine the most appropriate course of action that remains within regulatory boundaries. The ultimate goal is to provide accurate, reliable diagnostic information while upholding the highest standards of professional conduct and regulatory compliance. Question 9. Strategic planning requires a medical laboratory scientist to anticipate potential challenges in accurately identifying bacterial pathogens from patient samples. When presented with a gram-stained smear exhibiting pleomorphic gram-negative rods in a mixed cellular background, which systematic approach best ensures accurate preliminary classification and supports appropriate clinical decision-making, adhering to regulatory standards for diagnostic accuracy. Option A. Prioritize the gram-negative reaction and the rod shape, then consider common gram-negative bacilli that present with pleomorphism in similar specimen types, noting any characteristic arrangements. Option B. Focus solely on the pleomorphic nature of the rods, as this is the most unusual characteristic, and report pleomorphic gram-negative rods without further consideration of shape or arrangement. Option C. Immediately assume a common enteric pathogen based on the gram-negative rods and proceed with standard biochemical testing without further microscopic evaluation. Option D. Rely on the patient's chief complaint to infer the most likely bacterial identity, using the gram stain primarily to confirm the presence of bacteria. The correct answer is A. Prioritize the gram-negative reaction and the rod shape, then consider common gram-negative bacilli that present with pleomorphism in similar specimen types, noting any characteristic arrangements. Explanation. Scenario analysis. This scenario is professionally challenging because the accurate identification of bacterial morphology and classification is foundational to effective patient treatment and infection control. Misidentification can lead to inappropriate antibiotic selection, delayed or incorrect therapy, and potential spread of resistant organisms, directly impacting patient outcomes and public health. The MLS must exercise meticulous attention to detail and a thorough understanding of gram staining principles and bacterial characteristics. Correct approach analysis. The correct approach involves systematically evaluating the gram stain results, noting the shape, cocci, bacilli, spirilla, arrangement, clusters, chains, pairs, and gram reaction positive, negative of the observed bacteria. This detailed morphological assessment, combined with knowledge of common pathogens and their typical presentations, allows for accurate preliminary classification. This aligns with CLIA 88 regulation, which mandate that laboratories perform accurate and reliable testing, ensuring that qualified personnel are responsible for the accurate performance and reporting of test results, including the interpretation of microscopic findings. Best professional practice dictates a systematic, evidence-based approach to ensure diagnostic accuracy. Incorrect approaches analysis. One incorrect approach is to rely solely on the gram stain color without considering the morphology or arrangement. This is a regulatory failure under CLIA 88, as it bypasses the requirement for comprehensive test performance and accurate reporting. Ethically, it compromises patient care by potentially leading to misdiagnosis. Another incorrect approach is to make a definitive identification based on a single morphological characteristic without considering other factors or performing further confirmatory tests. This violates the principle of thoroughness mandated by CLIA 88 for accurate laboratory diagnostics. It also poses an ethical risk by providing incomplete or potentially misleading information to the clinician. A third incorrect approach is to assume the identity of the bacteria based on the patient's clinical presentation alone, without rigorous microscopic examination. While clinical context is important, CLIA 88 requires that laboratory results be based on validated testing procedures. Relying solely on clinical suspicion without laboratory confirmation is a direct violation of regulatory standards and an ethical breach of professional responsibility. Professional reasoning. Professionals should employ a systematic diagnostic process. This begins with meticulous specimen preparation and staining. Next, a thorough microscopic examination is performed, documenting all observable morphological features. This information is then correlated with known bacterial characteristics and clinical context. If necessary, further confirmatory tests are performed to achieve a definitive identification. This structured approach ensures compliance with regulatory requirements for accuracy and reliability, while upholding the ethical obligation to provide the highest quality patient care. Question 10. Operational review demonstrates that a significant number of red blood cell indices on automated complete blood counts are suggestive of potential microcytic hypochromic anemia. Further investigation is required to rule out or confirm hemoglobinopathies and thalassemias. Which of the following diagnostic strategies best aligns with regulatory requirements for accurate and reliable laboratory testing in this context? Option A. Rely exclusively on the automated CBC indices to assess the severity of the anemia and exclude hemoglobinopathies. Option B. Report a presumptive diagnosis of thalassemia based solely on microcytosis and hypochromia observed in the CBC. Option C. Perform hemoglobin electrophoresis, and if indicated by the results, follow up with high-performance liquid chromatography, HPLC, or DNA analysis for definitive characterization. Option D. Recommend genetic counseling for the patient without performing any further laboratory testing. The correct answer is C. Perform hemoglobin electrophoresis, and if indicated by the results, follow up with high-performance liquid chromatography, HPLC, or DNA analysis for definitive characterization. Explanation: scenario analysis. This scenario presents a professional challenge due to the potential for misdiagnosis of a hemoglobinopathy or thalassemia, which can have significant implications for patient management, genetic counseling, and public health screening programs. The MLS must accurately identify the specific type of hemoglobin abnormality or thalassemia to ensure appropriate clinical follow-up and prevent potential complications. The challenge lies in differentiating between various forms of these inherited disorders, some of which may present with subtle laboratory findings or overlap in their characteristics. Correct approach analysis. The correct approach involves utilizing a comprehensive diagnostic strategy that integrates multiple laboratory methodologies. This typically includes initial screening tests such as a complete blood count, CBC, with red blood cell indices, followed by hemoglobin electrophoresis. For cases where results are equivocal or suggest specific variants, further confirmatory testing like high-performance liquid chromatography, HPLC, or DNA analysis may be necessary. This multimodal approach aligns with CLIA, Clinical Laboratory Improvement Amendments, regulation, which mandate that laboratories perform accurate and reliable testing to ensure patient safety and quality of care. The emphasis on confirmatory testing for abnormal findings is a cornerstone of good laboratory practice and regulatory compliance, ensuring that diagnoses are not made on preliminary or potentially misleading results. Incorrect approaches analysis. One incorrect approach would be to rely solely on a single screening test, such as a CBC, without proceeding to confirmatory hemoglobin analysis. This fails to meet the analytical performance standards required by CLIA for the accurate identification of hemoglobinopathies and thalassemias. Such an approach could lead to misdiagnosis or misidentification of the specific disorder, directly impacting patient care and potentially violating the CLIA requirement for proficiency in testing. Another incorrect approach would be to report a definitive diagnosis of a specific hemoglobinopathy or thalassemia based on preliminary or incomplete testing, without performing confirmatory studies. This constitutes a failure to adhere to established laboratory protocols and quality control measures, which are mandated by CLIA to ensure the accuracy and reliability of test results. This premature reporting can lead to inappropriate clinical decisions and patient harm, representing a significant ethical and regulatory breach. A third incorrect approach would be to interpret results without considering the patient's clinical presentation or ethnic background. While the question focuses on laboratory findings, a comprehensive interpretation, as expected of a medical laboratory scientist, should integrate all available information. Ignoring clinical context or known population predispositions to certain hemoglobinopathies or thalassemias can lead to misinterpretation of laboratory data and a failure to provide a complete diagnostic picture, which indirectly impacts the quality of service and patient safety. A core tenet of laboratory practice under CLIA, professional reasoning. When faced with potential hemoglobinopathies or thalassemias, the MLS should follow a systematic diagnostic algorithm. This begins with a thorough review of the CBC and red blood cell indices to identify potential microcytic, hypochromic anemia, or other red cell abnormalities suggestive of these disorders. If screening tests indicate a potential abnormality, the next step is to perform hemoglobin electrophoresis, or HPLC, to separate and quantify different hemoglobin types. If these results are abnormal or inconclusive, further investigation with DNA analysis may be warranted. Throughout this process, it is crucial to maintain meticulous documentation, adhere to established quality control procedures, and consult with supervisors or specialists when necessary. This methodical approach ensures compliance with CLIA regulations, upholds professional standards, and ultimately safeguards patient well-being. Question 11. Consider a scenario where a medical laboratory scientist, MLS, receives a TDM result for a patient on vancomycin that is significantly above the established therapeutic range. The MLS has performed routine quality control checks on the instrument and reagents, which are within acceptable limits. The physician has requested an immediate interpretation and recommendation for dose adjustment. What is the most appropriate course of action for the MLS? Option A. Assume the elevated level is due to a recent dose administered shortly before the blood draw and recommend withholding the next dose without further investigation. Option B. Verify the accuracy of the vancomycin assay by reviewing instrument logs and reagent lot numbers, then correlate the elevated level with the patient's clinical status, including the timing of the last dose and renal function, before communicating findings and recommendations to the physician. Option C. Immediately report the elevated vancomycin level to the physician and recommend a significant dose reduction based solely on the reported value. Option D. Inform the physician that the result is elevated and suggest they consult a pharmacokineticist for interpretation, without providing any further laboratory-specific information or initial correlation. The correct answer is C. Immediately report the elevated vancomycin level to the physician and recommend a significant dose reduction based solely on the reported value. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in therapeutic drug monitoring, TDM. The professional difficulty lies in balancing the need for timely and accurate patient care with the complexities of interpreting TDM results, especially when they fall outside established therapeutic ranges. Misinterpretation can lead to inappropriate clinical decisions, potentially causing patient harm through under- or overtreatment. The professional must exercise sound judgment, relying on established protocols and a thorough understanding of the drug's pharmacokinetics and pharmacodynamics, as well as the patient's specific clinical context. Correct approach analysis. The correct approach involves a systematic and evidence-based process. First, verifying the accuracy of the laboratory result is paramount. This includes checking for pre-analytical errors, e.g., improper sample collection, storage, or transport, and analytical errors, e.g., instrument malfunction, reagent issues. Once the result is confirmed as accurate, the next step is to correlate it with the patient's clinical status, including the timing of the last dose, the patient's renal and hepatic function, and any concurrent medications that might affect drug metabolism or excretion. This comprehensive correlation allows for an informed interpretation of whether the drug level is truly supertherapeutic or subtherapeutic, or if it is within an acceptable range given the patient's condition. The professional then communicates these findings and their interpretation to the prescribing physician, providing recommendations for dose adjustment or further monitoring based on established TDM guidelines and the patient's individual needs. This approach aligns with the CLIA 88 regulations, which mandate accurate and reliable laboratory testing and require that laboratory professionals exercise professional judgment in the performance and interpretation of tests. It also adheres to professional ethical standards that prioritize patient well-being and the provision of accurate diagnostic information. Incorrect approach is analysis. One incorrect approach is to immediately report a supertherapeutic drug level without any verification or clinical correlation. This fails to account for potential laboratory errors, which are a violation of CLIA 88 quality control and proficiency testing requirements. It also bypasses the crucial step of clinical correlation, leading to potentially unnecessary and harmful interventions for the patient. Another incorrect approach is to assume the drug level is correct and simply recommend a dose reduction without considering the patient's clinical status or other contributing factors. This demonstrates a lack of comprehensive understanding of TDM principles and can lead to suboptimal patient care. Furthermore, failing to communicate the findings and interpretation to the prescribing physician, or communicating them without adequate context, is a failure in professional responsibility and can impede effective patient management. This also contravenes CLIA 88 requirement for clear and accurate reporting of test results. Professional reasoning. Professionals should approach TDM interpretation by first ensuring the integrity of the laboratory data through rigorous quality control and error checking. Subsequently, they must integrate this data with the patient's clinical picture, considering all relevant factors that influence drug disposition. This integrated approach, guided by established TDM guidelines and professional judgment, allows for accurate interpretation and informed recommendations. The process should always involve clear and timely communication with the ordering physician, facilitating collaborative decision-making for optimal patient outcomes. Question 12. The investigation demonstrates a significant discrepancy between a patient's reported symptoms of hyperglycemia and a laboratory result indicating normoglycemia. The medical laboratory scientist is tasked with determining the most appropriate next step. Option A. Proceed with reporting the normoglycemic result without further investigation, assuming the patient's symptoms are unrelated to glucose metabolism. Option B. Immediately report the normoglycemic result to the physician, advising them to disregard the patient's reported symptoms as potentially subjective or misinterpreted. Option C. Recommend that the patient be retested at a different laboratory facility without investigating the current laboratory's performance or the sample's integrity. Option D. Initiate a comprehensive review of the patient's medication list and recent dietary intake, followed by an assessment of the sample's pre-analytical integrity and a review of the analytical methodology and quality control data for the glucose assay. The correct answer is D. Initiate a comprehensive review of the patient's medication list and recent dietary intake, followed by an assessment of the sample's pre-analytical integrity and a review of the analytical methodology and quality control data for the glucose assay. Explanation. Scenario analysis. This scenario presents a common challenge in clinical chemistry where a discrepancy exists between patient presentation and laboratory results. The professional challenge lies in interpreting these conflicting data points, considering potential sources of error, and determining the most appropriate course of action to ensure patient safety and accurate diagnosis. This requires a deep understanding of analytical principles, pre-analytical factors, and the clinical context. Correct approach analysis. The correct approach involves a systematic investigation of potential causes for the discrepancy. This includes reviewing the patient's clinical history and current medications, assessing the pre-analytical phase, e.g., sample collection, transport, storage, and evaluating the analytical phase, e.g., instrument calibration, reagent quality, interference. If a pre-analytical or analytical issue is identified, retesting the sample or collecting a new sample is paramount. This aligns with CLIA, Clinical Laboratory Improvement Amendments, regulations, which mandate quality control and proficiency testing to ensure the accuracy and reliability of laboratory results. Furthermore, it upholds the ethical principle of beneficence by prioritizing patient well-being and avoiding misdiagnosis or inappropriate treatment based on potentially erroneous data. Incorrect approaches analysis. One incorrect approach would be to immediately accept the laboratory result and disregard the clinical presentation. This fails to acknowledge the possibility of laboratory error, which is a direct violation of CLIA quality assurance requirements. Ethically, it breaches the principle of non-maleficence by potentially leading to patient harm through incorrect treatment. Another incorrect approach would be to solely rely on the clinical presentation and dismiss the laboratory findings without investigation. This ignores the diagnostic value of laboratory testing and could lead to overlooking a critical underlying condition. It also contravenes CLIA mandate for accurate and reliable testing. A third incorrect approach would be to make a diagnosis based on a single, potentially anomalous result without further investigation or correlation. This is professionally irresponsible and ethically unsound, as it bypasses the necessary steps for accurate diagnostic confirmation and could lead to significant patient harm. Professional reasoning. Professionals should approach such discrepancies with a systematic, evidence-based methodology. This involves 1. Acknowledging the discrepancy and its potential implications. 2. Thoroughly reviewing patient history and clinical context. 3. Critically evaluating the pre-analytical and analytical factors that could influence the result. 4. Implementing appropriate corrective actions, such as retesting or sample collection. 5. Communicating findings and recommendations clearly to the clinical team. This structured approach ensures adherence to regulatory standards and ethical obligations, ultimately safeguarding patient care. Question 13. Upon reviewing the antimicrobial susceptibility testing results for a significant bacterial isolate, the medical laboratory scientist observes that the zone of inhibition for a critical antibiotic falls just outside the susceptible range, but the bacterial colonies are growing very close to the edge of the zone. The laboratory's standard operating procedure indicates that results within 2 millimeters of the breakpoint should be considered for further investigation or confirmation. What is the most appropriate course of action? Option A. Report the isolate as susceptible, assuming the close growth to the zone edge is due to minor technical variation. Option B. Immediately report the isolate as intermediate, as this represents a compromise between susceptible and resistant growth. Option C. Perform a repeat susceptibility test on a fresh isolate and consult with a clinical microbiologist if the results remain equivocal. Option D. Report the isolate as resistant to the antibiotic, as the zone is technically outside the susceptible range according to the initial measurement. The correct answer is D. Report the isolate as resistant to the antibiotic, as the zone is technically outside the susceptible range according to the initial measurement. Explanation. The scenario presents a common challenge in antimicrobial susceptibility testing, AST, where a laboratory scientist must interpret results that fall within a zone of uncertainty or exhibit atypical growth patterns. This requires not just technical proficiency, but also a deep understanding of regulatory guidelines and their implications for patient care. The challenge lies in balancing the need for timely reporting with the imperative to ensure accuracy and avoid misinterpretation that could lead to inappropriate antimicrobial therapy. Professional judgment is crucial in deciding whether to report a result as is, perform further testing, or consult with a medical professional. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established regulatory standards. By recognizing the ambiguity in the ASD results and seeking clarification or performing confirmatory testing, the laboratory scientist upholds the integrity of the diagnostic process. This aligns with the CLIA, Clinical Laboratory Improvement Amendments, regulations, which mandate that laboratories must have procedures in place to ensure the accuracy and reliability of test results. Specifically, CLIA quality system requirements emphasize the need for proficiency testing, quality control, and corrective action when test systems do not perform as expected. Furthermore, ethical considerations dictate that a laboratory professional should not report a result they are uncertain about, as this could directly impact patient treatment and outcomes. Consulting with the clinical team ensures that the physician has the most accurate and complete information for therapeutic decision-making. Reporting the result without further investigation, despite the observed anomalies, constitutes a significant regulatory and ethical failure. This bypasses the laboratory's responsibility to ensure the quality and accuracy of its testing, directly violating CLIA mandate for reliable test results. Such an action could lead to a patient receiving an ineffective or even harmful antibiotic, constituting a breach of professional ethics and potentially leading to adverse patient outcomes. Similarly, unilaterally deciding to change the interpretation without proper validation or consultation also fails to meet regulatory requirements for test validation and reporting. This circumvents established protocols and introduces an unacceptable level of subjectivity into the reporting process, again jeopardizing patient safety and violating CLIA quality assurance mandates. The professional reasoning framework for such situations involves a systematic approach. First, recognize and document any deviations from expected results or established quality control parameters. Second, consult internal standard operating procedures, SOP, for guidance on handling ambiguous ASD results. Third, if the SOPs do not provide a clear path or if the anomaly is significant, initiate confirmatory testing or retesting according to established protocols. Fourth, if uncertainty persists after confirmatory testing, consult with a supervisor, a senior technologist, or a clinical microbiologist. Finally, if the result has direct clinical implications and remains uncertain, communicate the findings and the uncertainty to the ordering physician, providing them with the necessary information to make an informed clinical decision. This iterative process ensures that patient care is not compromised by premature or inaccurate reporting. Question 14. Process analysis reveals that a medical laboratory scientist is performing a critical biochemical marker assay for a patient presenting with acute symptoms. The initial result obtained is significantly elevated, suggesting a life-threatening condition. However, the internal quality control, QC, for the assay is currently out of specification, and the instrument flags a minor error that has not yet been resolved. The laboratory has a policy that all results must have passed QC and be free of instrument flags before reporting. The MLS is aware that repeating the test will take approximately 2 hours, during which time the patient's clinical status could deteriorate further. Considering the potential for a false positive due to QC issues, what is the most appropriate course of action for the MLS? Option A. Document the elevated result in the patient's record but refrain from reporting it to any clinician until the QC is resolved and the assay is revalidated, regardless of the potential clinical impact. Option B. Hold the result and immediately initiate a repeat of the assay, while simultaneously notifying a supervisor or pathologist about the situation and the potential clinical urgency. Option C. Report the elevated result as a confirmed finding, assuming the QC issue is minor and unlikely to affect this specific patient's result. Option D. Report the elevated result immediately to the ordering physician, clearly stating that the QC is out of specification and the result is preliminary. The correct answer is D. Report the elevated result immediately to the ordering physician, clearly stating that the QC is out of specification and the result is preliminary. Explanation. This scenario is professionally challenging because it requires the medical laboratory scientist, MLS, to balance the immediate need for diagnostic information with the ethical and regulatory obligations to ensure patient safety and data integrity. The MLS must consider the implications of reporting preliminary or unconfirmed results, especially when those results could lead to significant clinical decisions. The correct approach represents best professional practice because it adheres to established laboratory protocols and regulatory guidelines, such as those outlined by the College of American Pathologists, CAP, or equivalent accrediting bodies in the U.S. These guidelines emphasize the importance of result verification and validation before reporting. Reporting a biochemical marker result that has not met all internal quality control, QC criteria, or has not been confirmed by a secondary method, if applicable, violates the principle of providing accurate and reliable patient information. This upholds the regulatory requirement for laboratories to maintain high standards of quality assurance and to report only validated data, thereby protecting patient welfare and maintaining the credibility of the laboratory. An incorrect approach of reporting the preliminary result without full verification fails to meet the standards of laboratory practice. This constitutes a regulatory failure as it bypasses established quality control procedures mandated by accrediting bodies. Ethically, it breaches the principle of beneficence by potentially exposing the patient to unnecessary or incorrect treatment based on unverified data, and it violates the principle of non-maleficence by risking harm. Another incorrect approach, such as delaying reporting indefinitely until a perfect QC run occurs, even if the preliminary result is highly suggestive of a critical condition, is also professionally problematic. While accuracy is paramount, extreme delays in reporting critical values can also negatively impact patient care, potentially leading to delayed life-saving interventions. This highlights the need for a nuanced decision-making process that considers both accuracy and timeliness, often guided by laboratory policies on critical value reporting. The professional reasoning process for similar situations involves a systematic evaluation of the data, the laboratory's established protocols, and the potential clinical impact of reporting or withholding the result. The MLS should first assess the QC status of the assay and the instrument. If QC is out of acceptable limits, the result is considered invalid. The next step is to consult laboratory policy regarding the reporting of preliminary or unconfirmed results, especially for critical analytes. If the result is highly suggestive of a critical condition, and the delay in reporting could cause harm, the MLS should escalate the situation to a supervisor or pathologist to determine the appropriate course of action, which might involve repeating the test or using an alternative method, while ensuring clear communication about the status of the result. Question 15. Examination of the data shows a patient presenting with fatigue, joint pain, and a malar rash. Initial screening for anti-nuclear antibodies ANA is positive with a speckled pattern. Given these findings and the potential for multiple autoimmune conditions, which of the following laboratory approaches best aligns with regulatory requirements for accurate and efficient diagnosis of autoimmune diseases in the United States? Option A. Discontinue further autoimmune antibody testing due to the positive ANA, as this is considered sufficient for a diagnosis of an autoimmune condition. Option B. Perform reflex testing for anti-dsDNA anti-SM and anti-Rho/SSA antibodies, and if positive, proceed to further specific autoantibody panels based on clinical suspicion and establish diagnostic criteria for systemic lupus erythematosus and Sjögren's syndrome. Option C. Order a comprehensive autoimmune disease panel that includes all available autoantibodies to ensure no potential diagnosis is missed, regardless of initial clinical presentation or ANA pattern. Option D. Report the positive ANA result as definitive evidence of lupus and recommend immediate treatment without further serological investigation. The correct answer is B. Perform reflex testing for anti-dsDNA, anti-SM, and anti-Rho/SSA antibodies, and if positive, proceed to further specific autoantibody panels based on clinical suspicion and establish diagnostic criteria for systemic lupus erythematosus and Sjögren's syndrome. Explanation. Scenario analysis. This scenario presents a common challenge in autoimmune disease diagnosis, where a patient exhibits symptoms suggestive of multiple autoimmune conditions, and initial screening tests yield equivocal or conflicting results. The professional challenge lies in interpreting these complex serological patterns within the strict confines of regulatory guidelines for laboratory testing and reporting, ensuring patient safety and accurate diagnosis without over-investigation or misdiagnosis. The MLS must navigate the nuances of antibody specificity, clinical correlation, and the limitations of laboratory assays while adhering to CLIA, Clinical Laboratory Improvement Amendments, regulations, which govern laboratory quality and patient test management in the United States. Correct approach analysis. The correct approach involves a systematic, algorithm-driven interpretation of serological results, prioritizing the most clinically relevant and diagnostically specific autoantibodies based on the patient's presentation. This aligns with CLIA mandate for accurate and reliable testing, ensuring that laboratory results contribute meaningfully to patient care. By focusing on established diagnostic criteria and confirmatory testing for suspected autoimmune diseases, the MLS upholds the principle of providing clinically actionable information. This approach minimizes unnecessary testing, reduces patient anxiety and cost, and ensures that the laboratory's contribution to diagnosis is both precise and efficient, directly supporting the CLIA requirement for quality patient testing. Incorrect approaches analysis. One incorrect approach is to order a broad panel of all available autoimmune markers without specific clinical correlation. This violates CLIA principles of appropriate test utilization and can lead to the detection of clinically insignificant autoantibodies, resulting in incidentalomas that cause patient distress and unnecessary follow-up investigations. It also represents a failure in efficient resource management within the laboratory. Another incorrect approach is to report preliminary or unconfirmed results without adequate clinical correlation or further confirmatory testing, especially when the initial findings are equivocal. This directly contravenes CLIA requirement for accurate reporting and can lead to premature or incorrect diagnoses, potentially harming the patient. The laboratory has a responsibility to provide reliable data that supports a definitive diagnosis. A third incorrect approach is to rely solely on a single autoantibody result without considering the full clinical picture or the possibility of cross-reactivity or interfering substances. This demonstrates a lack of critical thinking and a failure to adhere to best practices in laboratory medicine, which emphasize the integration of laboratory data with clinical information for accurate interpretation. CLIA expects laboratories to have processes in place to ensure the validity and reliability of test results. Professional reasoning. Professionals should approach such cases by first thoroughly reviewing the patient's clinical history and symptoms. This guides the selection of initial, most relevant autoantibody tests. Based on these results, a tiered testing strategy should be employed, moving to more specific or confirmatory assays only as indicated by the initial findings and clinical context. Collaboration with the ordering physician is crucial for interpreting complex results and determining the next steps. Adherence to established diagnostic algorithms for specific autoimmune diseases, as outlined by professional organizations and regulatory bodies like CLIA, is paramount. This systematic and clinically integrated approach ensures that laboratory testing is both scientifically sound and ethically responsible, prioritizing patient well-being and diagnostic accuracy. Question 16. Performance analysis shows a physician requests a specific, non-standard bone marrow examination technique for a patient with a complex hematological presentation, citing anecdotal evidence of its efficacy. The medical laboratory scientist, MLS, is trained in and has access to the standard, validated bone marrow examination techniques. The MLS recognizes that the requested technique is not part of the laboratory's approved procedures and has not undergone rigorous validation for this specific application. What is the most appropriate course of action for the MLS in this situation? Adhering strictly to U.S. regulatory frameworks and professional MLS guidelines. Option A. Consult with the pathologist or a senior MLS to discuss the physician's request. Review the scientific literature regarding the requested technique and determine the most appropriate and validated diagnostic approach for the patient. Option B. Perform the requested bone marrow examination technique as requested by the physician, assuming the physician has a valid clinical reason, and document it as performed. Option C. Refuse to perform the requested bone marrow examination technique, informing the physician that the laboratory only performs standard, validated procedures. Option D. Perform the requested bone marrow examination technique, but document it as a standard procedure to avoid unnecessary complications with the physician. The correct answer is A. Consult with the pathologist or a senior MLS to discuss the physician's request, review the scientific literature regarding the requested technique, and determine the most appropriate and validated diagnostic approach for the patient. Explanation. This scenario presents a professional challenge due to the inherent conflict between a physician's request for a specific diagnostic technique and the medical laboratory scientist's, MLS, responsibility to adhere to established protocols and patient safety. The physician's request, while potentially stemming from a desire for a particular outcome, may not align with the current best practices or the most appropriate diagnostic pathway for the patient's presentation. The MLS must navigate this by prioritizing patient well-being and the integrity of the diagnostic process, which are paramount in laboratory practice. The correct approach represents best professional practice because it upholds the MLS's professional autonomy and ethical obligation to ensure the accuracy and appropriateness of laboratory testing. By consulting with the pathologist or a senior MLS, the MLS is engaging in a collaborative problem-solving process that prioritizes patient care and adherence to regulatory guidelines. This ensures that the most scientifically sound and clinically relevant diagnostic method is employed, rather than simply fulfilling a potentially misguided request. This aligns with the principles of good laboratory practice and professional responsibility, which are often codified in professional standards and regulatory frameworks governing laboratory operations. An incorrect approach of directly performing the requested bone marrow examination technique without further inquiry or consultation is professionally unacceptable. This bypasses the established quality control and validation processes within the laboratory. It could lead to an inaccurate or irrelevant result, potentially misdirecting patient care and causing harm. Ethically, it demonstrates a failure to exercise professional judgment and a disregard for established protocols designed to ensure patient safety and diagnostic accuracy. Regulatory failure lies in not adhering to laboratory standard operating procedures, SOP, and potentially violating CLIA, Clinical Laboratory Improvement Amendments, regulations, which mandate quality control and proficiency testing to ensure the accuracy and reliability of laboratory results. Another incorrect approach of refusing to perform any bone marrow examination and simply stating it cannot be done without explanation is also professionally unacceptable. This demonstrates a lack of communication and problem-solving skills. While the initial request might be problematic, a complete refusal without attempting to understand the physician's intent or offer alternative solutions is unhelpful and can damage the interdisciplinary working relationship. Ethically, it fails to uphold the collaborative nature of patient care. A third incorrect approach of performing the requested technique, but documenting it as if it were a standard procedure without addressing the deviation from protocol, is a serious ethical and regulatory violation. This constitutes falsification of records and undermines the integrity of the laboratory's quality assurance system. It prevents proper oversight and review of laboratory processes and can have severe consequences for patient care and regulatory compliance. The professional decision-making process for similar situations should involve a systematic approach, First, thoroughly understand the physician's request in the clinical context. Second, evaluate the request against established laboratory protocols, scientific literature, and professional guidelines. Third, if there is any doubt or deviation from standard practice, consult with a qualified supervisor, pathologist, or senior MLS. Fourth, communicate clearly and professionally with the requesting physician, explaining the rationale for any proposed modifications or alternative approaches. Finally, document all decisions and actions meticulously. This process ensures that patient care is prioritized, diagnostic accuracy is maintained, and all actions are compliant with regulatory and ethical standards. Question 17. System analysis indicates that a clinical laboratory is considering the implementation of a new automated immunoassay system for expanded toxicology and drug screening capabilities. The laboratory director is eager to offer a wider range of drug panels to meet increasing demand. What is the most critical step to ensure regulatory compliance and patient safety before the new methodology is used for routine patient testing? Option A. Immediately integrate the new immunoassay system into the existing workflow, relying on the manufacturer's provided instructions for operation and interpretation. Option B. Prioritize staff training on the new instrument and assay, deferring formal analytical validation until after the system has been in use for several weeks. Option C. Conduct comprehensive analytical validation of the new immunoassay methodology, including accuracy, precision, sensitivity, and specificity, in accordance with CLIA regulations. Option D. Begin using the new immunoassay system for a limited number of patient samples, while simultaneously performing initial quality control checks. The correct answer is C. Conduct comprehensive analytical validation of the new immunoassay methodology, including accuracy, precision, sensitivity, and specificity, in accordance with CLIA regulations. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of toxicology and drug screening results, which can have significant legal, medical, and personal ramifications for patients. The MLS must navigate the complexities of maintaining specimen integrity, ensuring accurate analytical performance, and adhering to strict chain-of-custody protocols, all while facing potential pressure or external influences that could compromise these principles. The implementation of a new testing methodology introduces an additional layer of complexity, requiring validation and careful integration into existing workflows to prevent errors and ensure patient safety. Correct approach analysis. The correct approach involves a systematic and evidence-based implementation of the new immunoassay methodology. This includes rigorous analytical validation according to CLIA, Clinical Laboratory Improvement Amendments, regulations, which mandate proficiency testing, quality control, and method validation to ensure accuracy, precision, sensitivity, and specificity. Furthermore, it requires comprehensive staff training on the new instrument and assay, ensuring competency and understanding of the specific protocols for drug screening. Establishing clear standard operating procedures, SOP, that detail specimen handling, testing, result interpretation, and reporting is paramount. This approach aligns with CLIA's overarching goal of ensuring laboratory test quality and patient safety by demanding a thorough, documented, and validated process before routine use. It prioritizes patient care and the integrity of diagnostic information. Incorrect approaches analysis. Implementing the new immunoassay without comprehensive analytical validation and staff training would be a significant regulatory and ethical failure. CLIA mandates that all laboratory tests performed must be validated to ensure they meet established performance characteristics. Skipping this step risks generating inaccurate results, potentially leading to misdiagnosis, inappropriate treatment, or false legal implications for patients. It violates the ethical principle of beneficence by not acting in the best interest of the patient. Relying solely on the manufacturer's instructions without independent laboratory validation also presents a regulatory and ethical risk. While manufacturers provide guidelines, CLIA requires laboratories to perform their own validation to confirm the assay performs as expected within their specific laboratory environment, considering factors like reagent lot variability, instrument calibration, and operator technique. Failure to do so could lead to a breach of CLIA requirements for method validation. Introducing the new methodology for routine patient testing while still in the validation phase, without adequate quality control measures in place, is a direct violation of CLIA regulations. CLIA mandates continuous quality control to monitor the performance of laboratory tests. Performing tests without proper QC is a failure to ensure the reliability of results and compromises patient safety. Professional reasoning. Professionals in medical laboratory science must adopt a systematic approach when implementing new testing methodologies. This involves a thorough understanding of relevant regulations, such as CLIA in the United States, which govern laboratory quality and patient safety. The decision-making process should prioritize patient well-being and the integrity of diagnostic information. This includes 1. Regulatory compliance, identifying and adhering to all applicable federal and state regulations, e.g., CLIA Cap. 2. Method validation, conducting comprehensive analytical validation to confirm the accuracy, precision, sensitivity, and specificity of the new assay. 3. Quality control, establishing and diligently following robust quality control procedures. 4. Staff competency, ensuring all personnel are adequately trained and demonstrate competency in performing the new test. 5. Documentation, maintaining meticulous records of all validation, training, and quality control activities. 6. Risk assessment, evaluating potential risks associated with the new methodology and implementing mitigation strategies. By following these steps, MLS professionals can ensure the reliable and safe implementation of new technologies, upholding the highest standards of laboratory practice and patient care. Question 18. Analysis of a situation where a physician orders CBC with differential for a patient who has recently undergone chemotherapy and is presenting with fever and fatigue. The laboratory scientist notes that the standard CBC with differential order does not typically include specific enumeration of immature granulocytes, which can be a critical indicator of bone marrow recovery post-chemotherapy. The physician has not specified any additional parameters. What is the most appropriate course of action for the medical laboratory scientist? Option A. Contact the ordering physician to clarify if they require specific enumeration of immature granulocytes or other specialized parameters relevant to post-chemotherapy monitoring. Option B. Perform a CBC with differential and add the enumeration of immature granulocytes without consulting the physician. Assuming it is implied, Option C. Inform the physician that the standard CBC with differential is insufficient for monitoring post-chemotherapy recovery and suggest they order a different test. Option D. Perform a standard CBC with differential and report the results as ordered. Correct answer is D. Perform a standard CBC with differential and report the results as ordered. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a physician's directive and the medical laboratory scientist's, MLS, responsibility to ensure accurate and reliable patient care. The physician's request, while seemingly straightforward, could lead to misinterpretation of a critical diagnostic finding if not handled with strict adherence to established protocols. The MLS must balance the need for timely results with the imperative to maintain the integrity of the diagnostic process, especially when dealing with potentially life-altering conditions. Correct approach analysis. The correct approach prioritizes patient safety and diagnostic accuracy by adhering to established laboratory protocols and regulatory guidelines. Specifically, in the U.S., the Clinical Laboratory Improvement Amendments, CLIA mandates that laboratories establish and follow written policies and procedures for all aspects of laboratory testing, including specimen handling, testing, and reporting. The MLS's action of verifying the physician's intent and ensuring the correct test is performed aligns with CLIA requirement for quality control and accurate reporting. This upholds the professional standard of care by preventing potential errors that could lead to misdiagnosis or inappropriate treatment. It also reflects ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Incorrect approaches analysis. One incorrect approach involves immediately performing the requested test without clarification. This violates CLIA regulations by bypassing established procedures for test ordering and verification. It risks generating a report that is not clinically relevant or could be misinterpreted, potentially leading to patient harm. Ethically, this demonstrates a failure in due diligence and a disregard for the principles of accurate diagnosis. Another incorrect approach is to refuse to perform any test and simply inform the physician that the request is unclear. While it highlights the ambiguity, it fails to actively resolve the issue and contribute to patient care. This approach could be seen as uncooperative and not in the spirit of interdisciplinary collaboration, which is crucial in healthcare. It also doesn't fulfill the MLS's role in facilitating appropriate diagnostic testing. A third incorrect approach is to perform the test as ordered, assuming the physician knows best, and then inform the physician of the result. This is problematic because it assumes the physician's intent without confirmation, potentially leading to a report that is not what the physician actually needs. This bypasses the critical step of ensuring the correct diagnostic pathway is followed, risking wasted resources and delayed or incorrect clinical decisions. It also fails to uphold the laboratory's responsibility for accurate and relevant reporting. Professional reasoning. Professionals in this situation should employ a systematic decision-making process. First, identify the ambiguity or potential discrepancy in the request. Second, consult established laboratory protocols and regulatory requirements, e.g., CLIA, for guidance on handling such situations. Third, communicate clearly and professionally with the requesting physician to clarify the intent and ensure the correct test is ordered. Fourth, document the interaction and the final decision. This process ensures patient safety, regulatory compliance, and the highest standard of professional practice. Question 19. The efficiency study reveals that a patient presents with elevated levels of specific amino acids, increased urinary organic acids, and abnormal acylcarnitine profiles. Considering the interconnectedness of metabolic pathways, which analytical approach best guides the medical laboratory scientist in identifying potential inborn errors of metabolism? Option A. Exclusive reliance on the patient's presenting symptoms to infer the underlying metabolic defect. Option B. Prioritization of the most common inborn error of metabolism based on population prevalence. Option C. A singular focus on the most elevated amino acid to identify a potential urea cycle disorder. Option D. A systematic, pathway-by-pathway analysis correlating observed biochemical abnormalities with known enzyme deficiencies and their clinical manifestations. The correct answer is D. A systematic, pathway-by-pathway analysis correlating observed biochemical abnormalities with known enzyme deficiencies and their clinical manifestations. Explanation. Scenario analysis. This scenario presents a professional challenge for a medical laboratory scientist, MLS, by requiring them to interpret complex metabolic pathway data in the context of clinical relevance, specifically for a patient with suspected inborn errors of metabolism. The challenge lies in synthesizing information from multiple metabolic pathways, understanding the downstream effects of enzyme deficiencies, and correlating these findings with patient presentation and laboratory results. Accurate interpretation is critical for timely and appropriate patient management, making careful judgment paramount. Correct approach analysis. The correct approach involves a systematic pathway-by-pathway analysis, correlating observed biochemical abnormalities with known enzyme deficiencies and their clinical manifestations. This aligns with best professional practice as mandated by CLIA, Clinical Laboratory Improvement Amendments, regulations in the U.S., which require accurate and reliable laboratory testing and reporting. Specifically, CLIA quality system requirements emphasize the need for qualified personnel to perform and interpret tests. By focusing on specific metabolic pathways, e.g., amino acid metabolism, carbohydrate metabolism, organic acid metabolism, and linking them to potential enzyme defects and their clinical consequences, the MLS demonstrates a comprehensive understanding of metabolic disorders. This approach ensures that all relevant biochemical data is considered, minimizing the risk of misdiagnosis or delayed diagnosis. It also reflects the ethical responsibility of the MLS to provide accurate and clinically relevant information to the healthcare team. Incorrect approach is analysis, focusing solely on a single abnormal analyte without considering its position within broader metabolic pathways, is a significant regulatory and ethical failure. This approach risks overlooking compensatory mechanisms or alternative metabolic routes that might be contributing to the observed abnormality, leading to an incomplete or inaccurate diagnosis. Fails to meet the CLIA standard for comprehensive testing and interpretation. Prioritizing the most common metabolic disorder without a thorough evaluation of all available data is another failure. While common disorders are statistically more likely, this approach can lead to a misdiagnosis of a rarer but equally serious condition. It bypasses the systematic analytical process, required for accurate diagnostic laboratory science. Relying exclusively on patient symptoms without integrating the biochemical data is also professionally unacceptable. Symptoms are subjective and can be indicative of many conditions. The MLS's role is to provide objective biochemical data and its interpretation. Ignoring this data in favor of clinical presentation undermines the core function of the laboratory and violates clear requirements for test interpretation. Professional reasoning. Professionals should approach such scenarios by first reviewing all available patient information, including clinical history and presenting symptoms. Then, they must systematically analyze all laboratory data, identifying abnormal analytes. The critical step is to then map these abnormalities onto known metabolic pathways, considering potential enzyme deficiencies and their upstream and downstream effects. This requires a deep understanding of biochemistry and the clinical manifestations of metabolic disorders. The MLS should then correlate these biochemical findings with the patient's clinical presentation to formulate a differential diagnosis or confirm a suspected diagnosis. This iterative process of data analysis, pathway mapping, and clinical correlation ensures the most accurate and clinically relevant interpretation, adhering to regulatory standards and ethical obligations. Question 20. Benchmark analysis indicates that a patient presents with fatigue and pallor, and initial laboratory results show a hemoglobin of 9.5 g/dl and a hematocrit of 28%. Which of the following diagnostic approaches best aligns with best practices for classifying and initiating the diagnosis of anemia in a U.S.-regulated laboratory setting? Option A. Rely solely on the patient's reported symptoms to determine the most likely cause of anemia. Option B. Proceed with a comprehensive iron study panel, vitamin B12 and folate levels, and a peripheral blood smear examination immediately. Option C. Initiate a reticulocyte count and a lactate dehydrogenase (LDH) level to assess for hemolysis. Option D. Evaluate the red blood cell indices, specifically the mean corpuscular volume (MCV), to guide subsequent diagnostic testing. The correct answer is B. Proceed with a comprehensive iron study panel, vitamin B12 and folate levels, and a peripheral blood smear examination immediately. Explanation. Scenario analysis. This scenario presents a common challenge in hematology where a patient exhibits signs of anemia, requiring accurate classification and diagnosis. The professional challenge lies in selecting the most appropriate diagnostic pathway based on initial laboratory findings and clinical presentation, ensuring adherence to established diagnostic algorithms and regulatory guidelines for laboratory testing. Misinterpretation or premature diagnostic conclusions can lead to delayed or incorrect treatment, impacting patient outcomes and potentially violating CLIA regulations regarding accurate and timely reporting of test results. Correct approach analysis. The correct approach involves a systematic evaluation of red blood cell indices, particularly the mean corpuscular volume, MCV, to guide further diagnostic testing. This aligns with best practices in anemia workup, as outlined by professional hematology organizations and implicitly supported by CLIA regulations that mandate proficiency and accuracy in laboratory testing. Classifying anemia based on MCV, microcytic, normocytic, macrocytic, is the foundational step that directs subsequent investigations, such as iron studies, vitamin B12/folate levels, or tests for hemolysis, ensuring a logical and efficient diagnostic process. This systematic approach minimizes unnecessary testing and maximizes the likelihood of identifying the underlying cause of anemia. Incorrect approaches analysis. An approach that immediately orders a broad panel of tests without initial red blood cell index evaluation is inefficient and potentially violates CLIA emphasis on appropriate test utilization and cost-effectiveness. It represents a failure to apply established diagnostic principles, leading to unnecessary resource expenditure and potential for overwhelming the patient and laboratory with irrelevant data. An approach that relies solely on clinical symptoms without correlating them with laboratory findings is diagnostically unsound and ethically problematic. A clinical presentation is crucial. It must be integrated with objective laboratory data. This approach risks misdiagnosis and delayed treatment, failing to meet the standard of care expected of a medical laboratory scientist operating under CLIA. An approach that focuses on a single, less common cause of anemia without first ruling out more prevalent etiologies based on initial indices, is also inappropriate. This demonstrates a lack of systematic diagnostic thinking and could lead to overlooking the actual cause of the anemia, thereby failing to provide accurate and timely diagnostic information as required by CLIA. Professional reasoning. Medical laboratory scientists must employ a systematic, evidence-based approach to anemia diagnosis. This involves 1. Reviewing the complete blood count, CBC with differential, paying close attention to red blood cell indices, MCV, MCH, MCHC. 2. Correlating these indices with the patient's clinical presentation. 3. Utilizing established diagnostic algorithms to guide further testing based on the initial classification, e.g. microcytic anemia prompts iron studies, macrocytic anemia prompts B12/folate assessment. 4. Ensuring all testing is performed with accuracy and reported in a timely manner, adhering to CLIA regulations. This structured decision-making process ensures diagnostic efficiency, patient safety, and regulatory compliance.